It's Harmon Dash here again with Dr. Stuart Phillips from Make It Fair, and we're talking about healthcare. It's a hot topic these days. You know, how do we provide affordable access to more people? And with it being Breast Cancer Awareness Month, we wanted to cover the fact that the American Cancer Society reported over a 35-year period, 1980 to 2015, breast cancer death as an outcome dropped 40%. Now, how did that happen?
It happened because we've spent a huge amount of time, money, and expertise. And, you know, when one person gets cancer of the breast, it's catastrophic for them. And when they die, it's a tragedy. But we have been studying this, and we have been putting a huge amount of effort into it. And the people in the United States have been giving money to it. The national government has. The exciting thing is it works. When the United States sets its mind to something, we can do it.
So what you're saying is access to screenings, access to regular checkups, access to the healthcare system as a whole has allowed for more lives to be saved.
Yes, and because this is a study of the whole population over a 35 or 40 year period, we can be very precise. We know that without adequate medical care, how many extra people will die from breast cancer each year. And if we were to do away with the insurance for 20 million people.
You like some of these repeal attempts of the ACA you're referring to?
What repealing the ACA would do away with medical care for 20 million people.
Okay, and how many lives would be lost to breast cancer for that?
And of that 20 million people, there would be almost 1,000 extra deaths.
Per year?
Yes.
And that's just breast cancer?
From that. So people are getting their diagnosis early, and it's easier to treat an early lesion.
Of course, so early detection leads to better outcomes.
The second thing is we've got better treatment. And it's really gotten much better in the last 5 years, but you don't see that in this data because, you know, it takes a lot of time to get that data. So it's going to be even better 5 years from now.
Mm-hmm.
But from our standpoint of governance and social justice, what we want to emphasize is that you can't get screening in the emergency room. If you do away with the ability of people to have affordable health care with no cost screening, you are going to kill women. We are beginning to conquer it, and we shouldn't go backwards.
These are not services you can get at the emergency room. So if we want early detection for breast cancer or any kind of cancer, we need to have access to these services.
That's right. The argument that, oh, these folks will have medical care, they'll go to the emergency room is a fallacious argument. You can't get a mammogram in the emergency room, and you can't get early detection. Now think about that when you say, we can't afford to guarantee health care. Think about the fact that you're giving a death sentence to 1,000 of your wives, sisters, and mothers. Maybe we can afford it. Maybe we can learn to do it cheaper. Maybe we can learn to do it better. Maybe we can even tax people. Everyone wants to tax those rich people, but maybe we can tax everybody a little bit. We have the ability to do that. We have a wealthy society. We can afford free screening, and adequate chemotherapy and good surgery for all of our people. We have the money, we just need the will.
Well, it is Breast Cancer Awareness Month, and we want to thank you for making us more aware. Well, of course, we want to know what you think. Should we have access to health care for purposes of early detection and for lots of other reasons? Why do you think people need to have access to health care? We would love to hear your comments on our website, makeitfair.com. Find us on Facebook and Twitter as well. For Dr. Stuart Phillips, my name is Harmon Dash. Thank you for watching Make It Fair.